web series on cancer care, all that you want to know about anemia. This show is supported by Shilpa Medicare. Now, anemia is widespread in India. 58.6% of children and 53.2% of non pregnant women and 50% of pregnant women were found to be anemic in 2016. India carries the highest burden of the disease despite having an anemia control program which has been running for 50 years. Anemia is a condition in which a person has an insufficient number of red blood cells or the quantity of hemoglobin, which reduces the capacity of their blood to carry the oxygen. So there's less hemoglobin going around the blood to carry the oxygen to various organs. Normal hemoglobin for women is 12 grams per deciliter, and for men, it's 13. Now, anemia doubles the risk of death during pregnancy and leads to poor motor and mental growth in children. It can also lower productivity in adults and cause up to a 4% loss of the gross domestic product, according to a study. So, why do we have so much anemia in our country? There are many reasons: inadequate dietary intake of iron, defective iron absorption, increased iron requirements due to repeated pregnancies and lactation, poor iron reserves at birth, frequency of infections in children, and excessive physiological blood loss during adolescence and pregnancy are some of the causes for the high prevalence of anemia in our country. So we are trying to understand that why has the government's flagship program not had such a big impact so far? What steps need to be taken, and how critical is the anemia situation in our country? To discuss this, please welcome Dr. Pawan Kumar Singh, Head Haemato Oncology and Bone Marrow Transplant at Haemato Oncology at Artemis Hospital. Thank you so much, Mr. Singh, for joining us today. And it's a pleasure to have you with us. Now, we are discussing anemia in our country, and usually when you think of anemia, you think of only women and largely pregnant women. How prevalent is this? The data shows that more than half the population has anemia. Is this true?
Yeah, first of all, I would like to thank you and thank you, Anisha and Silpa Medicare for inviting me for this usually informative and important, pertinent topic, anemia, which is the question which you have asked is about the prevalence of anemia. So, if we go by the WHO data, so yes, definitely, sorry. So, yes, definitely. The prevalence, what you have mentioned, is around 50% of non-pregnant women and in children as well. So anemia is a problem. First thing I want to mention: anemia by itself is not a disease; it's a manifestation of disease. And the most important cause of anemia is the nutritional deficiency. And in nutritional deficiency, the three important factors which are responsible for the production of hemoglobin are most important one is the iron, then other two are vitamins, that is vitamin B12 and folate. So these are the three important factors which deficiency of them can lead to nutritional anemia. And as per WHO data, in resource poor countries the prevalence is quite common. Almost 50 to 60% of children and pregnant women and non-pregnant women, they suffer from this disease, that is anemia. So government is also from government side also and from WHO, supplements are provided and awareness is there, but still we see this much number.
Right. Uh, Dr. Singh, the statistics say half our population has anemia, which is largely, and a large proportion of that is women and children. But half our population doesn't live under the poverty line. Half our population doesn't have access to food. So is that what
Yeah.
explains such a
So
large proportion of our
yeah,
population is anemic, but they do have a regular diet, right? What's
I'll
the disconnect?
I will come to that. So if we see the WHO definition of anemia, it is less than 12 gram. So yes, the data is correct. The data says that half of population is anemic. So which means if you check the whole population hemoglobin, so they will not fit into, but sometimes it comes as 11, 11.5. They, and even with very low hemoglobin, because in nutritional deficiency the hemoglobin falls gradually, and that does not cause symptoms. Sometimes even if the hemoglobin is 7 8 grams, people don't feel symptoms. Only thing is that sometimes they feel, most common symptom is weakness, especially on, and effort intolerance, weakness on doing heavy work. So, and if you have sedentary life, you're sitting at home doing household works, you may not feel symptoms of anemia. So that is why, but by definition, yes, if you see, if it is less than 12, that much is the number. So that is correct data. So, but
So,
yes,
Dr. Singh, when is it problematic? When is
yeah.
anemia
So
problematic? When it is below a threshold where it doesn't affect me, or
hmm,
when it reaches a stage where I get too tired every day? When is it a
it is,
problem?
the symptoms of anemia comes when the hemoglobin falls rapidly. Suppose if anybody's hemoglobin falls from 12 to 7 in just 1 or 2 days, that can happen in case of bleeding. Suppose if anybody, that's what happens with the, and people, patient can die also. That happens in road traffic accident. Most commonly, common cause of death in road traffic accident is the blood loss, because their hemoglobin falls rapidly. But if the hemoglobin falls slowly, gradually over a period of months, few months, then the body gets adapted to it, and they may not feel symptoms. But yes, it for children it's very important, because for proper growth, hemoglobin is very important. If they don't have their normal hemoglobin in normal range, they will have growth retardation and other problems, bone pain, bones become weak, like that. And for sorry, for adult patients where there is no problem of growth, so there actually the problematic thing is that because of low hemoglobin they feel weak, and their quality of life is not that good, so they will not be able to do heavy work. They will be uh, doing normal routine works, and ultimately if the hemoglobin falls further below, they will have difficulty in doing their normal work as well. And sometimes they can feel, they can have pain in legs, a pain in other parts of body, mainly it is the muscle ache. So myalgia and muscle ache, all these kinds of
Right.
symptoms are there.
So, Dr. Singh, what explains the high prevalence of anemia in our country? You said, the lack of nutrients, notably iron and, of course, folic acid. Shouldn't our diet, cover all of that? Why is it so prevalent in India? I mean, not many people
Yeah, so
have a diet very different in India than, say, other parts of the world. Or is it that our diets are like, are built in such a fashion that we don't get enough nutrients? What's the problem?
so uh, so yes, why this nutritional deficiency, why these factors are deficient in resource poor countries? So first thing is that the if we see the good source of iron, so what are the food items which have good iron content? So one is obviously the non-vegetarian diet, because especially the red meat, which is not our routine diet. So especially in India, if we see, and other thing is other food supplements, which other food items which have a good iron source is the cereals and green leafy vegetables. So, and cereals also, if you see like ragi, jowar, bajra, they are good source of iron, and green leafy vegetables otherwise. So sometimes, and other thing I want to mention is that sometimes in means uh, good affordable people also, because of their dietary habits, if you eat a lot processed food, then also they are deficient in iron, because the processed food like noodles and other things, which you, most of the people call it as junk food. So actually if you see, it is actually junk food. It will not have those kind of nutrients. So this is about the iron. So good source of iron is non-vegetarian diet. Then other source is cereals, and the other third source is the green leafy vegetables. Then when we come to B12 and folate, so B12 again, the B12 source is the good source is again non-vegetarian diet. So that has got good vitamin B12. Vegetarians not good option for both B12 and folate. Not very good source. Eggs are theirs. They have B12 plus. Normally, our intestinal flora they produces B12 and folate. So that's how vegetarian diet compensates for it. But yes, if again if their flora, if they have GI disturbances, then they can have deficiency of B12 and folate as well.
So, Dr. Singh, what is the way then to treat this problem? There is only as much as you can do to influence someone's diet. If I'm a vegetarian, you cannot force me to eat red meat.
Yeah.
If I cannot afford it, if I cannot afford dal, you can't say, no, no, you'll get anemia, you better buy and eat dal. In our country, how can you then overcome this problem? Is it going to be supplements? Is that the only way out?
Yeah, sometimes from government side also they food supplements. I don't know from government. Nobody has from government also there. Nobody has ever thought of supplementing iron in the cereals or in the diet because if you remember, now we see iodine supplement in salt. Almost every salt comes with iodine because iodine, and that really made difference because there was because of iodine deficiency, a lot of goiter was there. So after supplementing iron in this iodine in salt, so that problem has almost overcome.
So,
And
Dr. Singh, you're
so
talking about fortification of food.
yeah, so one thing is that fortification. When we are looking at mass, means when you are looking at whole population, fortification of food is the thing which can be done, like vitamin D supplementation in ghee and iodine supplementation in salt. But the problem with iron supplementation and B12 folate supplementation in food, it's actually not cost effective, and you cannot put iron in that because it has got its own means. How can you because it's the cereals and other things, and we have other good sources of that. So one thing is that green vegetables we can increase in our diet. Then cereals if you see like wheat, even wheat has got other bajra, jowar, which are not very costly. So like and that can be taken. So the other thing is the most important thing is that we have to recognize this problem. So when if you are feeling weak and this, it's better to get the hemoglobin checked. And then even if you take medicines also for B12, folate, or iron medication, they are also not very costly. Iron tablet cost you around just 25-50 paisa one tablet.
Right. So then, Dr. Singh, should supplementation be the way out? See, the government runs a very effective maternal care program where, pregnant mothers go into care centers. They are advised about the nutrition. They are also given supplements during the course or in the run up to the pregnancy or during the pregnancy to take these. It also there is also midday meal programs running across the country in schools. So, could supplementation happen here? Do you think, this is going to be an effective way? I don't know how many kids will pop pills if you told them
So
to.
that government they have to decide about supplementing these. Obviously, they will be so whatever food and other things they are supplying it, that usually that should be enough. If they are the if the in midday meal, or if the foods normal food what they are getting, actually that food should supplement the oxygen. So fortification, whether I don't know, that government has to make policy whether that will be feasible. First, they have to conduct a study, proper population based study. Then only they will be able to implement it for whole population. So, but yes, as a person, not as a policy maker, but as a person, as a doctor, as a physician, and as a patient, or as a normal person, what we can do is we can increase these sources, these food items in our diet and take care of that, and to avoid junk foods. And the other thing is to take as much as vegetables, especially kids. Even I told you, for Rich people also, it is because of the food habit. These
Mm.
deficiencies are a problem.
Right. Um, I'm just checking with you, Doctor, saying the anemia control program of the government has been running for many years now, decades now. And as much as I understand, this program was based on supplements, on giving tablets. How tough is it to pop pills? And I'm trying to understand why it's not working. Do people forget to take it? Do people don't consider it important enough? Do women consider taking pills only important when you're pregnant, when the child has come?
The
Who
first
cares
thing is
about
that most of the
myself?
people, yeah, first of the thing, most of the people will not realize that they have a problem, they have a disease. So then they will ask why to take supplement, why to take medicine. It's not actually supplement; it's actually medicine. They feel that they are being treated. So probably that could be one reason. Other one is the supplement, iron supplements usually causes almost 30 to 40% of people can have GI disturbances. So even if they take, maybe after few doses, they may skip it, they if they develop any mild GI intolerance like that. So maybe these are the two problems which I can suggest on, but we have to see in the population based surveys.
All right. So you're saying that perhaps the best way forward is to actually improve on one's diet so that you don't even come to a stage where you
Yeah,
develop
so yeah,
anemia.
yeah.
All right. So then, Doctor Singh, let's go over again the good foods to eat. There are some states in our country who believe that if you have lot of ghee, doodh, makhan, you get very good diet, and you don't need anything else. You don't even need the vegetables, etc. But correct me if I'm wrong. But there's no iron in milk products, right? So,
Yeah,
what are
so
the
like milk
good
products,
foods?
yeah, you can call them as milk products. Milk products are not source of good source of, in fact, not at all. They don't have milk products don't
Any
have iron.
iron?
Yeah,
So,
they
can
can
you
provide you
tell us
other
the
vitamins which
names?
it's, yeah.
Can you
So
give us the names? You said cereals, it's a broad classification. You
so
said
cereals,
leafy vegetables.
yeah, I
So
told
give
you.
us some names. Like, is it palak, methi? Is
Yeah,
it,
so
you said
green
bajra?
green leafy vegetables. So these are like good source of iron. So one is you can say that any green leafy vegetable. So green leafy means chlorophyll. So chlorophyll and other things, they have they have iron also. And other thing is the cereals. So cereals means what we commonly know and as wheat, rice. These are the cereals. Rice is not a good source of iron, but wheat, ragi, jwar, bajra, these are the things. And nowadays, people's even you get. In fact, if you see, if you go to malls and other grocery store, you will find bajra wheat, bajra ragi, and these are like these cereals. You will find it more costlier than rice or wheat,
They're called
but
superfoods now.
actually should not be. So because earlier days, the production of these cereals was not, farmers don't produce these cereals a lot, but nowadays because of the demand, it is coming up. So yes, because of that, their prices, they are more costlier than wheat or rice. But
Right.
yes, they are better source of iron. And for those who are non-vegetarian, there should not be a problem.
So are you saying even fish and chicken are good sources of iron and folic acid?
Not best non-vegetarian source. I told you, for this is for that, it is actually red meat.
All right. So, what role does supplementation have to play? Now, I'm conscious of my health, and I'm trying to include all these good foods so that all my bases are covered, not just iron, even vitamin D, vitamin C, etc. Is there a case for supplementation? Prophylactically, would you say that one can pop an iron pill once in a while, or on perhaps some sort of a regular basis? To ensure that you do not get anemia.
See, if you the as a person, I don't recommend that every person should take pill, iron pill. So they have to be cautious about their health. If they feel any weakness, or they should, it's better to get it checked. Hemoglobin testing is not, it's available everywhere, not very costly also. So if you get even CBC, so that tells you and depending on that report, first to find out whether it is because of iron deficiency or whether it is because of it is because of B12 or folate deficiency, depending on that. Uh, but only thing is, what people need to understand is to understand the problem, and to when the symptoms are there, like symptoms of weakness, they feel that if any person feels that weakness is there, and especially after doing heavy work or climbing stairs, they feel a lot of pain in leg, they should get it checked.
Dr. Singh, are there any other telltale signs that one may be deficient in anemia or folic acid or B12 other than plain fatigue?
Other if iron deficiency is there, like severe iron deficiency, if they have they can have other signs or symptoms. For one thing is that they can have their nails will be brittle, so fine, very thin, brittle nails. So that is also one sign of iron deficiency. And other thing is that they can have excessive craving for ice or mud. So these are like seen in severe iron deficiencies. And obviously other symptoms like weakness and pain in legs, these are there. For B12 they can have abnormal taste sensation. B12 deficiency, B12 is also important vitamin for nerves, so they can have burning sensation in feet and hand. And plus they can have hyperpigmentation of knuckles, their knuckles can be seen as more dark black. So these are like signs of B12 deficiencies,
Mhm.
B12 and folate deficiency.
Right. Dr. Singh, what about young women and adolescents who have very heavy periods, girls who have heavy periods? Are they also at risk at anemia? What can
Yeah,
they do?
so that is why by WHO definition, if you see for women means menstruating women, the normal range of hemoglobin is 11 to 13, and for males it is 12 to 14. So because of regular menstrual blood loss, their hemoglobin is usually 1 gram less. So that is their normal range. But yes, if any female she's having more of menorrhagia, more of menstrual blood loss, then they should get it checked and should consult a gynecologist to look for any problem why the bleeding is more, and that need to be corrected, because otherwise their hemoglobin will never come up to normal.
And what about the case of children? You know, as a mom, I know it's very difficult to get your kids to eat palak and methi. So, how do you ensure that kids don't have an iron or a folic acid deficiency?
So yeah, one thing is that that's the thing. So cereal, we have to modify their diet according to their choices, and you can give them like nowadays oats and other things are there. They are like sources of good iron. They can be made variety of food so that they get the taste of that. Otherwise, yes, green vegetables. Even I also don't like, but yes, we don't have other
Yes.
choices. So somehow they have to at least. I'm not saying that they have to take it daily, but at least yeah, every second day, third day, they can have these
Hmm.
things in their diet.
Right. So, Dr. Singh, what is the protocol followed? If I feel tired, fatigue, I usually think I haven't slept well and I'll just try to get more sleep. And when should I go to a doctor? What will the doctor
Yeah,
do?
if
And then
these
what is the
symptoms are
treatment?
yeah, if these symptoms are persistent, like for this is going on for days or for months, then better to get it checked. It's not like that one day I'm feeling fatigued and one day I'm feeling tired. That does not mean that I'm having anemia.
Okay. And getting checked means getting a simple blood test.
Getting a simple blood test, CBC, complete blood count, so that will give the information of the hemoglobin number. And sometimes some other indices are there that you have to consult with the doctor. Some red cell indices are there, so that can guide us the type of whether it is because of iron or B12 folate deficiency.
And after, if there is
After
a
that,
diagnosis.
then the actually, if you want to know, you can get the level serum iron profile done, serum ferritin, which is a marker of iron. So you can get a serum ferritin test, and you can get a serum B12 and folate level also. These tests are also available almost all private and government labs.
Right. Then, Dr. Singh, I'm guessing the treatment, should your hemoglobin be low, would be supplementation. What is the course of supplementation that
Yes. So
patients may
this is
have to
very,
take?
yeah, this is very important. So once anybody is started on iron supplementation, It has to be taken for at least 4 months and in a proper dose. The proper dose of iron is 200 milligram per day for if we are correcting the hemoglobin. And other thing is it has to be taken empty stomach. So iron medication should always be taken empty stomach, half an hour before meals. And 4 months.
Right.
If
And
anybody feels GI disturbances, they can make it at least twice a day.
right. Dr. Singh, is there any restriction to the kind of foods you can eat if you're taking iron supplementation or other multivitamins that you take if you are having an iron
That's why
supplement?
other supplements, it's fine, but vitamin C increases iron absorption. So other thing is that food. So that's why it is recommended to take it empty stomach, because there are some factors in foods which hampers the iron absorption, like oxalate, phytates, especially in vegetables. So these are the things. So that is why it is recommended to take iron as empty stomach, half an hour before meal.
All right. Dr. Singh, thank you so much for joining us today and telling us more about anemia, the type of problems that come up because of anemia, how is it diagnosed, and what are the treatments for anemia. What Dr. Singh has pointed out is that eating a good and a rich diet is an easy way to keep anemia at bay. So do make that effort. And if you ever feel fatigued or if you feel that there is a loss of output for a prolonged time, do get yourself tested. Thank you so much, Dr. Singh, for joining us this evening.
Thank you. Thank you, Anisha. Thank you.
If you have questions about anemia, you can send them to us through our WhatsApp button. You just have to click on that button on our Facebook page. And don't forget to follow us and stay updated on all that concerns your health and well-being. This program was supported by Shilpa Medicare. Keep sending us your questions and we'll try to include them in the next show. Till then, stay at home and take care. Stay safe. See you soon.